gosh, it's so conflicting to have a song that makes me want to like. So I think it took about less than a minute before I got my first comment saying, react to Ren's new song. Yes, Ren has come out with a new song called Troubles. I've been really enjoying Ren's music, especially the mental health related or themed music, and it gives a lot of content to reflect on this mental health channel. So I'm gonna like the song even before listening to it. I've never heard it before, but it's liked. Now, for those of you who don't know, my name's Dr. Sil. I'm a junior doctor from Australia training to become a psychiatrist, and I make mental health reaction and educational videos in my free time. And I work in mental health wards with, treating people with schizophrenia or depression, mania, personality vulnerabilities, situational crises, lots of different things. But in my free time, I make some of these videos. So, without further ado, let's just get straight into it.
I don't reach into the past very much for these shards of shattered glass and harsh paper cuts. Leave me stop when I reach in, memories are seeped in. Hydrochloric acid, I go to war and get passive and freeze up. Music help the ice to thaw, put the chisel in the middle, swing the hammer of Thor. Pull it out of the impossible, Excalibur sword. Etching notepads full of reasons why my feelings are sore. The first day that I got sick, ejected from the cockpit of living. 19, young teen, waking up bitten. Posters up, manhunt, Ren went missing. Hard to have faith when the gods don't listen. The first hit maybe was the hardest. Waking in the body that was buried like a carcass. Brain in the lion's den, body in the shark pit. Waking up in pain again, aching, broken hearted.
Oh. Gosh, Ren packs a punch in not very much amount of time. I would say if there was a metric for emotional intensity per second, Ren would be one of the highest. That's really vivid imagery. I don't reach into the past very much because of these memories are like shards and paper cuts. Like that's imagery anyone can kind of connect with. And these memories that are steeped in hydrochloric acid that feel like shards of ice and causing paper cuts. This is trauma, but it's with defense mechanisms and therapy that we can live again and hopefully grow. Using music to manage emotional pain is a defense mechanism. It's called sublimation, and it's considered an adaptive, a helpful defense mechanism. Defense mechanisms we all use, I use, you use. It's just the ways that we deal with conscious or even unconscious anxiety, pain, distress, that kind of thing. And they can be helpful or unhelpful. So if when I'm feeling overwhelmed, I, get into a fight and punch someone in the head, that would be acting out. That would be an unhelpful way of managing my stress, anger, and anxiety. But writing a song, that would be called sublimation. That would be taking the energy and pain of one thing, such as a traumatic memory, and putting it into something healthy and helpful for other people, such as music. My favorite form of sublimation is boxing. I just started a week ago, so I am not by any means a pro, but I do love boxing. So we all have our different defense mechanisms, and some are helpful, some are not. It's just important to be aware of them. And I have a lot of videos on defense mechanisms, and if you can try and do more helpful ones than unhelpful ones, life usually gets better. Let's keep going.
Pain again, aching, broken hearted. Persistent little blogger, I was bouncing from a doctor to a doctor to a doctor, like a table tennis game that has no end. So be the fate of Ren. Every single question answered with a question on the end. The second year I came to terms with giving up my dreams. Mine was severed from the means to help me write these rhyme schemes. Brain was inflamed, the fatigue was crushing. Hard to remain sane with your brain combusting. And the third year was murder, living in a purgatory full of worry. Wouldn't live to be 30. Lifestyle hurt me, always in my bedroom. Rearrange the alphabet and all the letters spell doom. Light hurt my eyes, popping pills to survive. When you're 23 and mentally you steadily decline. 24 I was poor, disability benefits. What's the benefit of disability? It's irrelevant. 25 and
Gosh, so yeah, that's a lot to go through. He's obviously discussing his journey through the healthcare system as someone who suffered from Lyme disease, which is a horrible bacterial disease and autoimmune response to it from a tick bite. And the thing with autoimmune disease is that your immune system is everywhere. There's actually certain parts of the body where there are no immune cells, such as inside the eye, but most of your body has immune cells and antibodies and white blood cells there. So if you have autoimmune conditions, it can affect you in so many ways. Fatigue is very common amongst people who have autoimmune conditions because what's really happening inside you is that you're running a marathon. All the cells are fighting, are active, are inflamed, and are hyper active, but you don't look it. You're just sitting there. But inside you, all the cells are metabolizing very quickly because they're fighting one another. And I know that with Ren, he had an autoimmune encephalitis. So he developed psychosis as a result of the inflammation of the brain. And whenever someone finds it hard to see light, yes, that could just be a migraine, but also it could be a meningitis. If you haven't had migraines before and it's a new symptom for you, definitely go get it checked out by a doctor.
scars that were etched, they crack. Elastic bands only stretch so far and then snap deep in psychosis. Hallucinations, troubled vision. This is from the underworld.
Oh, interesting. Troubled vision and psychosis. This was not what Ren had, but it just triggered a memory of mine. Charles Bonnet syndrome. Fun fact. This is a syndrome where people will have visual hallucinations filling out areas of poor vision. So if you have a glaucoma or, poor vision for any reason, you might see things in the area where there is no stimuli. But that, and the reason I bring that up is because that would not be considered kind of schizophrenia or a psychosis. That's a syndrome of your brain kind of filling out deficient information because you've got a blurriness of vision. Anyway, just a random bit of trivia for you.
My superstition, 25 living back at home with my mum, but not because I'm a bum, alone and physically done. So thin, so frail, so weak I'd become, and my skin so pale, never kissed by the sun. One time I carved a hole in my chest just to feel. I wish that was a metaphor, the struggle was real. When you're living in the Holocaust, you buckle and kneel. There's relief in the teeth of the kiss of cold steel. Facts, 26 I'm highly medicated and the pain sophisticated while I'm lying broken naked on my back. I bore my microphone until my coffin started dropping raw thoughts with the Grim Reaper knocking on the track.
Gosh, it's so conflicting to have a song that makes me want to get into it, but the content is so confronting. That point around self-harm, the kiss of cold steel. So emotional regulation is a big driver of self-harm and people hurting themselves, not necessarily to die, but to manage, to feel something, to re-embody if they're in a dissociated state, or to bring attention to a single point of focus because their brains are going all over the place. So self-harm doesn't necessarily mean they have an intent to die. It can be used as a defense mechanism to manage anxiety and distress and emotional dysregulation. But there are other defense mechanisms to try and train and bolster, because self-harm is what I would respectfully call not adaptive, not helpful long term, and trying to slowly progress to less harmful methods, like putting hand in a bucket of ice, and then going into new things like sublimation, exercise, distraction, connection, altruism, other different defense mechanisms. That's really the goal. That often needs therapy, and at times, if the emotional dysregulation is very severe, maybe medicines, of course. That has to be assessed by a doctor. I can't give any advice on YouTube, but yeah, that's just how it goes.
Man, lo and behold, I heard an angel beckon on this treacherous road. Was a stem cell doctor with a generous glow. In the cell transplant, pulled me out of the cold. And my skin got younger and my body got stronger. And my stomach felt hunger for a door that was closed. And my soul heard music music for the first time. Beauty was a word I'd use for this gift of gold. Oh Lord, I forgive you. Lord, I forgive you. Lord, I forgive you. Make me whole. This music I give you. Pain that I live through. Everything I've been through is yours to hold.
What a wonderful message from Ren there in those closing sentences. I think these conditions, fibromyalgia, POTS, positional orthostatic tachycardia syndrome, it's from a medical perspective, it's not what I've seen is they're not getting ignored. It's more that we don't have good tools to treat them, so we focus on what we can treat. But these are always being considered. But if you have a good, if you know the treatment for these things, please let me know, because there are treatments out there, but there's no kind of cure that's evident, and there's no good diagnostic testing for fibromyalgia. So they're just really tricky conditions. But I wouldn't go so far as to say that they're getting well. I try not to ignore them. I document them and I talk to the relevant doctors for input and advice. But that doesn't mean that they'll be cured and eliminated, because they're just really tricky to treat. Whenever you're deciding to treat an illness, you also have to consider the side effect of the medications. So, anyway, it's a tricky situation. I love the closing message around hope. Interesting, he says, we all deserve to have a life free of suffering. Well, that's an interesting thing. That's a very nice line, but I don't know if I agree with it per se. I think that it's inevitable that there will be suffering in life. But how about this? We all have the right to have a life that has suffering that we can endure. Yeah, that's a bit of a more nuanced Dr. Sill's take on it, because suffering's inevitable. Even people with what look like perfect lives, do a bit of psychotherapy with them, and you'll be able to see what's behind the curtains. But another absolute banger from Ren. Massive thanks to this incredibly talented artist, and super super catchy. Definitely adding it to my music playlist. All right, guys, that's it for this video. I wish you all a beautiful day. Call a loved one, tell them you love them, and I'll see you all in the next video. Bye for now.